So I'm Mike Fears. This is the second of 3 videos regarding the occupational health and safety profession in Alberta and discussions on regulation. In particular, I'm focusing on the BCRSP Connect Event from October in Calgary and the communications from the BCRSP and CSSE. So a major portion of the event in Calgary was the national framework. But the national framework itself during the event was not well described, explained, communicated, and what the actual purpose was seemed a little bit fuzzy given we're talking about the regulation in a particular province. So this is what the national framework looks like, and key thing with the presentation that I assume is related to this framework was the discussion of roles. In particular, certain organizations, if you see in the framework in the different levels, fulfill certain roles, and it's very critical, according to the presentation, that organizations fulfill those roles, focus on those roles, and do not cross boundaries between the different organizational roles. So, having looked at this document, it is pretty simplistic. It is a swim lane, one-page document that is apparently going to describe how the regulation of the profession in Alberta will take place. No. It is, from the best I can understand from chatting with a member of the Board of Governors, actually 2 of them, this represents a framework for discussion going forward of what they think it will look like on a national level. Not helpful at all in terms of any discussion within the province of Alberta. As I said in the previous video, there seemed to be a lot of, I'm not sure if it's misinformation or fear-mongering or what's going on here. Didn't make sense. And one of the things that I found interesting is they identified roles that I don't understand why they're so separate and have to be separate. Why is a professional college or association society so separate from a membership organization? Actually, I would see them very similar, if not the same thing. You would have to be a member of a college to practice, let's say a college of nurses or lawyers society or something like that. That's where your membership would be. So why do they separate this out? I don't understand. And it seemed that the BCRSP was pushing something along the lines of their direct involvement in the actual regulation. And I had a conversation with a member of the board afterwards, and he suggested a number of things to essentially that effect, that they would look for a mandate to create their own organization, that they were looking for title protection, and that they were doing it on their own, independently, as opposed to working with other organizations. Now, I have been told by another member of the board, well, that's not the official board policy, or that's not, that he doesn't speak for us, but it is a member of the board. And so who do I listen to, one member or the other member? And on the other hand, I don't have anything in writing. I've got a lot of he said, she said, and a lot of very ambiguous stuff. So we've got this very simplistic national framework, and this is what we're supposed to work with. It just doesn't make sense. Now, in anticipation of the 3rd video, there is the Alberta Society of Health and Safety Professionals that is actually moving forward with the process of trying to become a regulated profession. And they have, in contrast to the national framework, a 107-page document called Roadmap to a Profession. Now, it is an initial starting document from 2018, but it goes through the entire process of what is involved. So I think, and we'll discuss this in the next video, that the BCRSP CSSE probably should get on board with the ASHSP and that roadmap, and look at getting something a little bit more concrete, definitive, and effective. Thank you.